Mr. Secretary, welcome. Dave, also welcome, both of you. Good to see you. And, Mr. Secretary, I appreciate the time that you spent with me last week, discussing the budget. And, however, I am still deeply concerned about both the Human Services Development Block Grant proposal and the steep reductions in funding for services. And I just want to take a moment to state for the record that I am adamantly opposed not only to the funding cuts, but also to the block grant proposal. And just for the record, when we're talking about the block grant, it's the 6 line items: the mental health service, community programs, intellectual disabilities, community-based programs, behavioral service, health services, Act 152, county child welfare grants, and homeless assistance programs. Those are the things that are included in the block grant. I was really happy to hear that the County Commissioners Association, CCAP, has not agreed to a block grant in exchange for an agreement of funding cut in any size. And I'm still a little baffled at how they could support this statewide block grant concept. CCAP's own website paper discusses the possibility of experimenting only with a few counties on a voluntary basis and with no cuts in funding. I also have a hard time believing that the affiliates, and they are the county administrators for human services, mental health, intellectual disabilities, drug and alcohol, and the other ones, support the statewide block grant proposal or these funding cuts. The providers I've heard from of these services at the county level, and I've heard from them and I've had visits to them, have let me know of their opposition to the block grant proposal and also to the funding cuts. No one that I've spoken to, no one has seen efficiencies in services with the block grant. Instead, there will be a new block grant with a raft of new and additional rules and regulations, and that, I believe, something we just don't need at this time. Since our meeting, I've tried to figure out how many people will be affected by the dramatic reductions in funding for the critically needed services. Here's a couple things that I've come up with. For drug and alcohol, the number affected ranges from at least 4,300 to over 10,000 people who will be turned away from this treatment. CCAP calls these cuts devastating, and I agree with that. Only yesterday, the Secretary of Corrections, discussing the need to reduce prison overcrowding and to use alternative services, said that how are we going to make up with these cuts with the cuts in addiction treatment? These proposed cuts will not only hurt people, but in my opinion, will endanger public safety. In mental health, a 20% reduction in funding will cut services by over $110 million and will affect over 28,000 people who will not receive needed services. In addition, there are cuts to services with people with intellectual disabilities, $28 million, as well as cuts to child welfare and services for the homeless. An enormous amount of federal funding is also at stake here, as we discussed last week. And let me explain again. The proposal, I believe, as do many others, violates the federal maintenance of effort, MOE, requirements for the Medicaid under the Affordable Health Care Act. It does so by making changes in eligibility standards, methodologies, or procedures explicitly prohibited by the ACA. Secondly, the proposal violates the maintenance of effort requirements under the federal and alcohol drug block grant in the Substance Abuse and Mental Health Service Administration of SAMHSA. Third, for both drug and alcohol and mental health, I also believe the proposal violates the Federal Mental Health and Drug Alcohol Parity Act, which is the well-known Ministry Mental Health and Addiction Equality Act of 2008. Finally, Mr. Secretary, if you were to enact this proposal, the 4,000 to 10,000 people in need of drug and alcohol treatments, what would they do and where would they go? The 28,000 people in need of mental health treatment, where would they go? And what about the 15,000 people with intellectual disabilities now receiving services through the ID, community-based program assistance? What will they do for the services and where will they go? Again, I'm opposed to the block grant. I'm opposed to the cuts in services. And Mr. Secretary, I know from our meeting you care about these people very deeply also. So I would just like, if you'd like to comment on what I've just mentioned, I would appreciate it very much.
Thank you, Mr. Chairman. And That was certainly an awful lot of information, a lot of comments and questions, and I'm giving leeway to the chairman because he is the chairman of that committee. So take your time, Mr. Secretary, and answer the questions, and then we'll continue with the hearing. Thank you.
Representative, thank you. I don't know that I can remember all of it, but I'm going to do my very best. We certainly applaud you and your efforts to champion the causes you have championed over the years, especially with drug and alcohol, and I think we understand the importance of these funds. You mentioned something very important. You mentioned the federal health care law, and I want to circle back to that because that law imposes a lot of requirements on states, something called the maintenance of effort requirement. 80% of the funds that we have at the Department of Public Welfare are Medicaid, approximately. That leaves us with about 20% of our budget in state-only funds with which to really work with. 80% of our funds are covered by that federal maintenance of effort, which means that we cannot really make substantive changes to the Medicaid program. And the issue that we have as a Commonwealth is that the Medicaid program has grown over the past decade by well over 80%, while economic growth in the Commonwealth has barely grown at over 20%. We currently have a situation in the Commonwealth where we now have approximately 2 people working a full-time job and 1 person on the public welfare system or receiving public assistance. 10 years ago, we were at about 3.5 people working a full-time job to 1 person on the system. This has put great strain, financial strain, on the system. Revenues are growing at 2.5%, maybe 3%. The Department of Public Welfare is growing at over 8%. When looking at our budget, this was a challenging budget to deal with. Decreasing revenues, increases in costs, and we had to meet this budget. We had to focus on 20% of this budget, which is basically our state-only funds. Now, in working with the counties, over the past year, we've been listening to the counties and trying to work with them. They have been asking for flexibility for a long time. There's no question about that. Many of the county commissioners that I've spoken to have been asking for flexibility. We understand that the 20% reduction is certainly a challenge. However, with that flexibility and the ability to move funds around, we believe that they will be able to meet that challenge. Now, we are still working with the counties at this particular point in time. The governor's office, the department, and CCAP are working together and working through these issues. And I think, as you know, a budget is really a perspective and a point in time, and we will work with them to make sure that this works in the end. However, when we're left with only 20% of our budget to work with, and we have the kind of growth that we do in this department, unless we receive some sort of windfall financially or revenues are dramatically going up, something has to be reduced. And we feel that the block grant, giving counties the flexibility to deliver services at the most local level, is the best thing that we can do. We've seen historically that the counties have been able to deliver services, and sometimes when the state has taken it over, it hasn't done such a great job. So I think, we have a difference of opinion. We certainly want to work with you to be able to try and make this work in the final analysis, and I know of your opinion. I respect that. We certainly don't want to see anybody harmed, but I think that we're at a point where we have to make some tough choices, and that's what we've done in this budget, and we're working with the counties to ensure that that'll happen properly.
Mr. Secretary, I really appreciate what you had to say. We've got a disagreement. I think these cuts will be devastating to our most vulnerable citizens, and you said it's a proposal or whatever, an outline, this budget, and I really look forward to working with you and the legislature to help restore these cuts. I mean, and I do not see any efficiencies with these block grants. You don't have any details yet how they're going to work. I mean, I've heard from the people on the ground in the counties. I mean, they do not believe this is going to work. So, I mean, let's work together.
Yeah, absolutely. We look forward to working with you.
Okay.
I do want to just add one thing, if I can, on the federal maintenance of effort requirement. We have looked at that. We don't believe it's a violation. Our attorneys have looked at it. We'll continue to work with you on that issue, but we don't particularly believe, because of the state funding issue.
I am firmly believe that that is an absolute violation of MOE and also a violation of parity. So,
We'll continue to work with you on that.
thank you, Mr. Chairman.